Hi everyone, my name's Hannah. I'm a PA here at Winter Haven OBGYN, and I'm here to talk to you about your annual Well Woman exam. So one of the things that is so important as women is to have an annual visit where you talk to a provider and have a screening pap smear as well as a breast exam. You might hear that some clinics no longer do breast exams. The guidelines are always changing. Here at Winter Haven OBGYN, most of us like to continue to do them. When you arrive, you'll be roomed by a medical assistant who's going to ask you some very important questions regarding your past medical history, your social history, things like if you drink, smoke, if you're sexually active. We want to know what medications you're on and any allergies. All of these things are really important for us to treat you accordingly to your needs. After you're roomed, you'll most likely meet with a provider who will talk to you for a quick second before doing your exam. We'll have you get undressed. Usually everything off. We give you these nice gowns here. They're actually fabric gowns. You can leave them open in the front or the back, whatever feels most comfortable to you. Personally, I usually have my patients open them in the back. That way you're covered more when we sit and talk after your exam. Once you're undressed, you're gonna come to this lovely exam table. You're gonna sit on this white paper sheet we provide for you and cover your lap with a pink sheet. This gives you a little bit of privacy before we start everything. Once I come back in, we're almost always chaperoned by a medical assistant. I will go ahead and do a breast exam on you first. I always ask important things, any lumps, bumps, nipple discharge, anything abnormal for you that you've noticed recently. Depending on your age, we ask if you've had a recent mammogram. All of these things tie into our clinical picture when we go to examine you. Breast exams aren't painful. We typically have you raise one hand. We take a quick look, do a quick feel. Poke around on your belly. We also, with the breast exam, make sure there's no lymph node enlargement. So you might feel it reaching into your armpit or your clavicle area to make sure there are none. With your belly, we're just making sure you don't have any pain, any lumps that we palpate or feel with our hands. And then we'll move into the pelvic exam. If you've never had a pelvic exam before, this is a good time to tell us so we can walk you through what we're doing. But basically, we have a few instruments here that will help us with our exam for you. Provider is always going to be wearing gloves to keep both you and us protected. This is a speculum. There are different sizes depending on your needs. Speculums, the ones we use here, we keep them warm for you, for your comfort. Typically don't need lubrication, but if we do, we'll provide that as well. Speculums, we only use them wide enough to see your cervix. So we're not going to crank this thing open, and it should not be uncomfortable for you. You tell us what you're feeling and we'll try to make this experience as great as possible. With the speculum, again, we're going to look at your cervix. We're then going to use some tools to help us with the pap smear. A pap smear is essentially cervical cancer screening. What we do is we scrape off just the outer layer of cells. I say scrape, but it doesn't hurt. It's just a little bit of you might feel a tickling or a weird sensation down there, but not a painful one. Depending on your provider, they each use different tools. This is a pap spatula where we just ring it around your cervix. The MA or the medical assistant is gonna then dip it in formalin to send to the lab. This is the pap brush that goes inside your cervix. These two are usually combined together to create the full coverage we need of your cervix. This is a fancy, basically spatula and pap brush in one. This will cover the entire circumference of your cervix. Some providers prefer this one. Once we've done your pap smear and we've collected the results, we send it off to the lab. Now, a few things are different here depending on your age. For anyone under 30, our office also likes to run gonorrhea, chlamydia, and trich, which are your most common sexually transmitted infections. If you're over the age of 30 or even under the age of 30 and decline this test, all the pap smear is going to check for is abnormal cells on your cervix. If there are abnormal cells, it will usually test for a virus called HPV. Once the speculum is removed, we then do something called a bimanual exam. Now, a bimanual exam is where your provider will insert either usually one or two fingers and into your vaginal canal, and then they're going to feel on top of your uterus and your adnexa where your ovaries would be. We're making sure we don't feel any masses and that your uterus is appropriate sized with also no lumps or anything abnormal. We always tell you before we do this and we walk you through the whole process, but it's good to know what to expect. Some commonly asked questions about your annual Well Woman exam. One of the first is, does it matter if I'm on my period? I'll tell you, as long as you're not bleeding heavily, it makes no difference to us and the lab can still read your pap smear. If you're in one of your heavy cycle days, bleeding through almost a pad per hour or a tampon per hour, it's best to wait until you've slowed down with your menstruation. Otherwise, sometimes we'll have to bring you back to redo it if there's too much blood present. Another question commonly asked is, what if I have something going on and I'm embarrassed to bring it up? This is a judgment-free zone. Anything that you have going on in your life, especially as it relates to GYN or any of your medical needs, is very important for us to know so that we can treat you as needed. Like I said, we've heard it all here. There's no judgments, and we love to be able to talk to you about your medical and health needs. A third commonly asked question is, do I need a pap smear while I'm pregnant? This is something our midwife, Julie, most likely will bring up in one of her videos. However, you do get a pap smear while you're pregnant. The only difference is we only scrape it with the spatula. Nothing goes inside your cervix. This helps prevent infection to you or the baby. Thanks for watching this video. If you have any further questions, please give our office a call. We'd love to assist you in either answering your questions or seeing you as a patient. I appreciate you taking the time to check in, and it was so nice meeting you.